keep doing that. At the same time, we see that electronic detailing has remained stagnant. Back in 2001, about a quarter of physicians are participating in electronic detailing, rising up to 2007. But then we're starting to taper back down today in terms of detailing participation. Now, reasons for this are also decrease in invites, and you see at the top line here of the plot that since 2005 we see a decrease in invitations to do electronic detailing, but also the lack of rich relevant experiences for the physician, him or herself, which paves the way for the reemergence of video detailing as promising. So, video detailing, a lot of talk about it as really being able to give physician a relevant experience today. And if you think back, the early video detailing was a more rather crude experience. It was expensive. If you think back to iPhysician.net. But today, of course, the technology is a lot better. We have a lot higher resolution. There are video phones. The expense is a lot lower because most physicians have broadband in their office today. And actually, after a certain volume of video details, you can see that the cost is lower than a face-to-face interaction. And here's some data to support the possible success of video detailing reemerging. And you see here that interest in video detailing is very high, and it's continuing to increase. You do see here, though, use is rather low, but it's really important to look at who these people are that are currently using detailing so that we can help to increase adoption, of course, in the future. We find that neurologists and oncologists are the most likely specialties to be currently using video detailing. We find that people that are using video detailing, physicians using video detailing today, are very advanced users of media channels online. And perhaps the most important thing to know about the video detailing users is that they have very high expectations of customer service online. They're actually 4 times more likely than people that are not using video detailing to strongly agree that they believe pharma should have, they have high expectations of customer service, that they expect customer service from pharma. So 4 times more likely than those that are not using video detailing today. Which makes it integral that you make sure that video detailing is part of customer service on your sites. So here we have an example of the Chantix site. Pfizer's Chantix site, if a physician goes and clicks on the healthcare professional area, they can go through to the Pfizer Pro customer service portal. Now, once on Pfizer Pro, they're able to either decide if they want to click for more information here, or they can go to a video conferencing meeting, a Chantix live meeting. Now, providing the physician with this option is really important because you don't want to push the technology on the physician when we're really still trying to figure out where video detailing should fit within the industry today. Now, the types of video detailing with the greatest potential we find are physicians are most interested in working, doing video detailing with key opinion leaders, so they want expert colleagues online. And the next likely is to be doing a video detail with a rep at a call center, so not your own rep, just any rep on demand here. We find PCPs very likely to be interested in this type of video detailing, likely because they are dealing with so many different conditions and types of prescriptions that they might not have as much loyalty as some specialties to their rep. And on the bottom, we see here lower interest in doing video detailing with your rep at a scheduled time. So the takeaway really being that the on-demand nature is more important than the familiarity when it comes to the detailing here. Now, among people that are using video detailing, we do find very high satisfaction. And we also tend to see that the frequency of doing video detailing is a lot higher than the detailing done without a live element. And to close out the section of physician relationship with reps, we're just going to do a quick look at online sampling. Now, you see here that on the left side, interest in ordering samples continues to increase over the past 2 years. The actual online sampling use remains stagnant. And this is related to, if you see on the right side, that when we ask physicians if they could order samples online, a big chunk definitely say that they would see fewer reps. So we're going to just go and switch gears here to look at the change the internet has brought to the relationship with patients, which actually has probably been the greatest change. Now, the traditional patient-physician relationship, definitely one that was imbalanced. Physicians just sitting on the side, not engaged in the conversation, going with whatever the physician says, whatever diagnosis, and really the physician was the aggressor here, the one that controlled the discussion. But with all the information available online today for consumers, do we really need to reevaluate what is meant by good patient? Just like we said that physicians are growing increasingly dependent on the internet, we also see the same to be true for consumers. So this is a great slide. If you look at 2004, you can see that that physicians are saying that they go first to a doctor when a health issue arises, over a few hundred million. And then compared to online, obviously a lot smaller. But when you go to today, you see the doctor remains about the same, but there are about 50 million consumers saying that they go to the internet first when a health issue arises. So a great increase just from a few years ago. And if you look separately just at consumers that already go online for health information and ask them the same question, where do you go first when a health issue arises, they're just as likely to say that they go to the doctor as they are to the internet. They're also bringing the information that they find with them on the internet to the doctor's office, just like DTC campaigns have been promoting. And just a few years ago, it would have been rare to consider that with all online health consumption would actually lead to a change at the point of care. But you can see here that patients are definitely bringing information with them to the office. Only a sliver of the pie chart on the left showing that a very small number of physicians saying that they don't have any patients that bring information with them, health information with them to the office. We like to call them the empowered patients. And at the same time, physicians are not viewing this as a threat. You can see on the right side here that actually the majority of them say it's a good thing when patients bring in information to the office. And this has been increasing as well, this view, from 2 years ago. So rather than necessarily seeing this as a challenge to the medical community, they're able to see this as a good thing, as a way that consumers are able to better own their health care. And eventually that leads to them being able to explain symptoms better and needs better and able to interact with the physician in a much better engaging way than previously. And this relationship is not just one-sided, so we're also seeing physicians using E in the relationship today. We've seen an increasing number of physicians say they use the internet with physicians in the office. We're also seeing an increasing number of physicians saying they recommend sites to patients. So it's a great way for them to be able to direct their patients to credible sites. They're most likely to be recommending disease sites, general sites, and government sites. Lower down on the totem pole, though, being pharmaceutical sites that they're recommending to their patients.